Measure at the 13th rib. The cranial portion should be at least 3 rib spaces cranial to xiphoid, and the caudal landmark is at the gradiotrochanter. We are looking at to evaluate the GI transit time, GI motility, the mucosal surface, GI content, GI strictures, and GI obstruction, including foreign bodies and masses. Patient should be fasted 12 to 24 hours, and water should be held at least 2 hours before the contrast study. Use an iodinated contrast agent when perforation is expected. Barium leakage within the peritoneal cavity can cause foreign body granulomas, peritonitis, and adhesions. Iodinated contrast agents are satisfactory to look for obstruction, but they do not adhere to the mucosal surface, so they are poor contrast agents to evaluate the GI surface. For this video, we're using a barium contrast. The correct dose is 8 to 12 milliliters per kilogram for a dog and 12 to 20 milliliters per kilogram for a cat. For this, we are able to give the barium orally by syringe. You can also use a stomach tube to administer the contrast. We took a right lateral view immediately after administration and then took it again 15 minutes later. For a dog, a right lateral and ventrodorsal every 30 minutes until contrast agent reaches the colon and completely leaves the stomach or obstruction is ideal. For a cat, doing a lateral and ventrodorsal image every 15 minutes, 30 minutes, at 60 minutes, and every 30 minutes until contrast reaches the colon and completely leaves the stomach or an obstruction is identified. At the end, you want to evaluate the size, shape, and location of the GI structures. Evaluate transit times and use references for normal times. Evaluate intestinal patency. Look for repeatable focal narrowing of the lumen or contrast agent column. Look for a space occupying lesion. Evaluate whether the rugal folds or the mucosal surfaces are abnormal. Evaluate whether a smooth interface between the contrast and mucosal surface is present. Evaluate the wall of the bowel. Determine whether the pylorus opens to permit expulsion of the contrast. Note if you document a suspicious finding on multiple radiographs over time. When in doubt, send it out. If you are unfamiliar with interpreting GI studies or unsure about the results, send the images to a radiologist.